Thank you so very much for staying tuned in. And very soon we will be joined by our chief guest, Shri Ashwini Kumar Choubey ji, Honorable Minister of Health and Family Welfare, member of Lok Sabha. But before that, we wanted to bring you our leaders dialogue. So a lot of excitement is in store for all of you right here. In fact, very soon we're also going to be unveiling the Economic Times Doctor's Coffee Table book right here on this virtual platform. So there's a lot happening here. I'd like to request all our delegates to please send in questions for our various experts. I'm sure they'll be more than happy to answer the same. So we have our leaders dialogue now, the big healthcare reset, transforming the way of treating the patients, and the very best from the country are now joining in. May I now extend a warm welcome to our session moderator. We have with us Dr. Harsh Mahajan, MD, founder and chief radiologist, Mahajan Imaging, president of NATHEALTH. It's such a pleasure having you here with us, sir. Let me also present to you our power-packed panelists. We have with us Dr. Randeep, Guleria, Director, AIIMS. A very warm welcome to Dr. Sunil, Kumar, Director General of Health Services, Ministry of Health and Family Welfare, Government of India. May I also extend a warm welcome to Dr. Devi, Prasad, Shetty, Chairman and Executive Director, Narayana Health. We have with us Dr. Ambrish, Mithal, Chairman and Head, Max Institute of Endocrinology and Diabetes, Max Healthcare. A very warm welcome to Dr. Naresh, Trehan, Chairman and Managing Director, Medanta. He'll be joining us shortly. So let us look forward to this discussion. And may I now hand over to Dr. Harsh Mahajan, sir.
Thank you very much, Ms. Bhalla. And I welcome each and every person, and especially this, as you called it, a power-packed panel. These are really the stalwarts of healthcare in the country. And each and every face that you see before you has been so familiar on social media, on television, in print media. And today, I thank the Economic Times for bringing them all together onto one panel on this day prior to Doctor's Day, which is tomorrow, for a leaders' dialogue. And truly, these are leaders. The big healthcare reset, transforming the way of treating patients. And may I start with Dr. Randeep Guleria, who's been at the forefront of this fight against COVID-19, who is a pulmonologist, who's also the director of the All India Institute, also at the forefront in making policy, in making transformational changes in healthcare delivery systems, and facing the challenge that we've had for the last 16 months or so. So, Dr. Guleria, starting with you, what do you think are the lessons that we've learned from the pandemic, and how have things changed in the short term during the course of the pandemic to address the problems that we've had and the huge number of infections that we've seen in this country, especially in the second wave?
Thank you very much. Thank you, Harsh, for your kind words. And I'd like to start by thanking the Economic Times for having this Doctor's Day conclave. And it's indeed a pleasure to be part of this esteemed group. Your question actually is has multiple sort of answers to it. But I think the first thing that it has done, the pandemic has done, is it's put health on the center stage. It's made people realize how important health is, not only as far as its own area is concerned, but whether it be the economy, whether it be the industry, whether it be travel, health plays a crucial part because everything is interlinked with a person being healthy. And the pandemic showed that if we had a huge number of people who were not healthy, it created a huge problem, not only as far as the individual was concerned, but society at large had major issues in terms of what we thought was normal as compared to the pre-corona times. Secondly, it also showed the importance of public health systems. The public health system really was stretched. It was really in the forefront, and it showed why it is important for us to focus a lot on public health, including areas in rural India, and also that health is multi-sectorial. If we have to really focus on the future, we have to focus on preventive health a lot. It's not only in terms of infection control, but also for non-communicable diseases. And thirdly, what it showed was the importance of intersectorial coordination. We started off in the pandemic with very little, let's say, knowledge of how to go about doing it. We had shortage of PPEs, of ventilators, of N95s. We had very few testing labs. But because people from different sectors came together, whether it be engineers, whether it be doctors, whether it be entrepreneurs, whether it be philanthropists, we were able to really get everyone together, and it showed the resilience of our country if we work together as a team with different people. We had people from IIT coming together, volunteering to help in the health sector. We had manufacturers coming in. And I think it showed that we have the capacity to do a lot if we move out of our silos and have sort of more coordination with different sectors outside the health sector. And I think that was the third important thing that the pandemic showed us. A lot of other lessons like human behavior, importance of mental health, which we don't discuss that much, and that became really important. But I think I'll stop here and then we can have the discussion on other issues also. Thank you.
Thank you very much for putting things in context and how our lives changed over the period of the pandemic, and the fact that when different people come together, different industries come together, different minds come together, then we can really create a revolution, which we saw in the early months of the pandemic. Dr. Sunil, you run the entire Directorate General of Health Services. You're responsible for the way healthcare is delivered across the country, and your ministry was at the forefront of meeting this challenge. And very quickly, we saw that there was a pivot shift. And not only were you burning the midnight oil, and putting minds together, but also the emphasis on primary healthcare, on outreach, on digital health, all happened very quickly. So where do you think we are? How did we change during this short duration of 1.5 years? And what are the long-term plans so that we don't have to face this feeling of being overwhelmed ever again?
Uh, Thank you once again, Dr. Mahajan and distinguished panelists. And I would like to take this opportunity to thank the organizers for having invited me as one of the panelists. I am truly blessed and feel that it is an opportunity which has been given by the Economic Times, where we can really inform our audience as to what we are, where we want to be, and how we shall. So coming to your question, first of all, Dr. Mahajan, if you please permit me, I would like to say one thing about the second wave and the first wave. I see this as a continuous pandemic. It is not the waves. I think one of the facts or one of the areas where we are faulting or we are misplaced is giving them waves. As a result, what happens? Our guards tend to become lowered when we say that one wave has passed. The public gets an impression that it's over and second wave may not come. Then we start talking about the third wave. They get frightened. I think what we need to understand is that this virus is a part of our life, is going to be there for some time and has been there for some time. And therefore, we need to take it as a continuous process of our life. The only thing is we are artificially changing it in terms of waves by way of clamping down the curfews, by lockdowns, and several other physical measures. But otherwise, ultimately, it's a continuous process which can only be conquered or won by by public health measures such as vaccination. So that's where I'll thank you very much for allowing me to put my views there. Number two, as to where we are, the pandemic has taught us many things. And I must say, this is the beginning. The challenge thrown to us is massive, and we must take this opportunity to improve in multiple ways in terms of our infrastructure, in terms of the way we deal with our HR, the way we train our HR, in terms of many other public health problems and public health approach, including the approach or the policies which reach the remote areas or the villages. We are at the beginning of that phase, and we must take this thread and continue to wind this nicely with programs, with policies tuned to the time, to the needs of the people in such a way that it should be patient centric. It should be what the pandemic had taught. And those practical policies with the team approach, as Dr. Guleria has said, including the digital, including the information, including the electrical or electronic, IIT, etc., etc. This needs to go together, and we need to place those policies and practices in to the remotest place in India. And we can say that we have seen so many revolutions in India. Now it is time for a medical revolution. So that's where we are today. We are at the beginning of a medical revolution, and we must change it together in such a way that our lives change. And in the event of such future pandemics or threats, which are not unlikely, which they are likely to come again, we can meet them comprehensively without getting overwhelmed. So that's where we are, and that's what we need. Thank you very much.
Thank you, Dr. Sunil. I think you put things in perspective very well. And also this fact that rather than thinking of it as waves, if we think of it as a continuum, then probably citizens would not let their guard down. And also the emphasis, which, we have talked about for probably ever since independence, about primary care, about taking it to the periphery and all of that, but have not succeeded. I do hope that with you at the helm of affairs, that emphasis which we now place on it will not be let go of once we are over this hump. So thank you for that. It's also a pleasure for me to now welcome Dr. Trehan. Welcome, sir. And my next question is to Dr. Devi Shetty, who runs and is the founder of a chain of hospitals, not only in India, but abroad, highly respected and cutting edge, and also is a thinker who thinks beyond the obvious. Apart from being a cardiac surgeon of note, he has many innovative thoughts which he has put into practice as well, especially regarding how healthcare delivery should happen, how we can actually improve access to the last mile, and also about the skilling, the training of doctors, nurses, paramedics, healthcare workers. So, Dr. Shetty, with the pandemic, it suddenly dawned on all of us and the powers that be that, oh, we are short of manpower, we don't have adequately trained people, something which, was known for years. So how do you think, what would you suggest? I know you've written extensively, you've spoken extensively. What would your advice or suggestion be to powers that be at this juncture when we are in entering July of 2021, and we are about 16 months after beyond the pandemic?
Thank you very much, Dr. Mahajan, for your kind words. Dr. Guleria has really explained very well about how government and the private sector together can face any of the challenges. And I must admit that we have done a very good job altogether. Now, going forward, when the COVID started, all of us felt that this is a problem. We are facing a crisis. It will last for a year or 2 years. And one day there will be a declaration that COVID has gone and we are all going to live happily ever after. But the sad truth is, COVID is not going to go away for quite some time. For your information, the Spanish flu hasn't gone. The regular flu, what we are suffering now, once in a while, is definitely related to the Spanish flu, which happened 100 years earlier. So COVID is going to last for a few more years. Now, we have to really plan our life along with COVID, a kind of a peaceful coexistence. And I'm fairly certain that as the time passes by, the intensity and the severity and lethality of the COVID will only come down, because it is the interest of the virus that the host doesn't die. Because if the host dies, virus also will die. So it is a mutation, is its fight to survive. And in the process, we are very key people, and it has to look after us as well. So I believe that to plan the future, it is very, very important for us to accept that COVID is going to stay. If COVID is going to stay, what we need to do? The most important thing is we have to vaccinate ourselves as soon as possible. That's very important. And government, I know it's a very sensitive issue. There has to be some kind of an incentive for people to go and to vaccinate. Today, there is a lot of debate about, okay, is it safe and should I do it? Is it really required? All kinds of debate. One thing for sure, with our experience of 1.5 years, it has taught us clearly that if you are vaccinated, you are protected to quite a large extent. You will reduce the burden on the hospitals. You will reduce the risk for yourself and the family members. Vaccination. Second thing is, it is almost like we have got the question paper in advance. After going through what we have gone through in the last 2 waves, now we know what is the worst thing what can happen. So we know how much oxygen is required, how many ICU beds are required. So we need to prepare ourselves for the beds and the doctors and the nurses and the medicines and all the rest of it, predominantly in the tier 2, tier 3 cities. Because the tier 1 major cities are fairly now well equipped. And we have to, essentially, COVID really doesn't require thousands of ventilators. It requires a bed with oxygen supply, piped oxygen supply, and a compassionate nurse to take care, and few doctors can guide them. Essentially, it's not what killed the people is the overwhelming of the health system rather than the COVID disease itself. So I'm optimistic that we should be able to face the third wave and the subsequent wave, if ever happens, much, much better than what we have done today. I'm convinced about it, and I have no doubt the way proactively the government and the people are now reacting, I'm optimistic that we will be able to manage.
Thank you very much, Dr. Shetty, for that note of optimism and the fact that what we have learned in the last 2 waves will really help us in addressing any future waves if and as and when they come. It's a pleasure for me now to welcome the Honorable Minister for Health, Mr. Ashwini Choubey, and I'm told that he has to leave by 12. So we will just take a little recess now and hear the Honorable Minister. So over to the team from Economic Times.
Thank you so very much, Dr. Mahajan. And here it's once again our extreme pleasure to extend a very warm welcome to Shri Ashwini Choubey ji, Minister of State for Health and Family Welfare, member of the Lok Sabha. So what a pleasure that you could join us here, and you have worked relentlessly and made over 11,000 toilets for families in Bihar. People know, and when it comes to hygiene, you have worked so very hard. We look forward to hearing from you what you and the ministry are doing now, sir. खास अभिनंदन करना चाहेंगे श्री अश्विनी कुमार चौबे जी का, Honorable Minister of State for Health and Family Welfare, member of the Lok Sabha. We're privileged to have him here with us. Right here, as we look forward to this very, very special day, hearing from the very best.
He needs to unmute.
इकोनॉमिक टाइम्स द्वारा आयोजित डॉक्टर्स डे कॉन्क्लेव के इस अवसर पर आप सबों को बहुत बहुत बधाई और नमस्कार। आज के इस कार्यक्रम में उपस्थित श्री विनीत जैन जी, एमडी द टाइम्स ग्रुप, श्री कैलाश सत्यार्थी जी जो नोबेल शांति पुरस्कार विजेता है, वो भी शायद उपस्थित है। हमारे एम्स के डायरेक्टर डॉक्टर रणदीप गुलेरिया जी, शेट्टी जी, अध्यक्ष और कार्यकारी निदेशक नारायण हेल्थ, सुधा मूर्ति चेयरपर्सन इन्फोसिस फाउंडेशन, डॉक्टर हर्ष महाजन जी, डॉक्टर सुनील कुमार, डीजीएचएस डॉक्टर अम्बरीश मित्तल जी, और सभी आज के इस कार्यक्रम में उपस्थित हमारे भाइयों और बहनों, मुझे खुशी है कि आज चिकित्सा दिवस के अग्रिम मैं आप सबको मैं बधाई भी दे रहा हूं। आज इस अवसर पर मैं आप सबसे पहले उन सभी का आभार व्यक्त करना चाहूंगा जिन्होंने इस चुनौतीपूर्ण घड़ी में अपना जीवन ही नहीं बल्कि अपने परिवारों से भी दूर रहे और अपने पेशे के अनुरूप आचरण भी किया। इसमें जो चिकित्सक, नर्स, फ्रंटलाइन वर्कर्स, ये सभी वो लोग हैं जो मानवता और नम्रता के प्रवर्तक रहे। अगर उनके निस्वार्थ प्रयास नहीं होते तो कोविड के विरुद्ध यह जो लड़ाई देश के लिए एक भीषण युद्ध से कम न होती। और उसके हम कह सकते हैं कोविड के लॉकडाउन, पहला लॉकडाउन जो हुआ उसके पूर्व हमारे आदरणीय प्रधानमंत्री श्री नरेंद्र भाई मोदी जी ने पूरे देशवासियों को कोविड-19 से लड़ रही थी। बहुत ही विपरीत परिस्थिति में हम लोग इस प्रकार के वायरस से अवगत भी नहीं थे, न इस प्रकार की स्थिति किसी की सोच थी, और वैसी स्थिति में न हमारे पास साधन थे बहुत। फिर भी आदरणीय प्रधानमंत्री जी ने पूरे देश को एकजुट करके और चिकित्सकों, चिकित्सा कर्मियों के प्रति जो उत्साह जगाने का काम किया, उनके प्रति जो सम्मान प्रकट किया, वो सचमुच पूरा देश इस बात को लेकर के कह सकते हैं कि लोगों में बहुत आशा जगी, विश्वास भी जगा, और निसंदेह ये लोग कोरोना के वॉरियर्स हैं। इन्होंने पिछले 1-2 सोए रातें भी गुजारी, भयावह दिन बिताए हैं, और मन को झकझोर देने वाले ऐसे अनेक दृश्य हमने देखे हैं। परंतु यह उनकी इच्छा, उनकी जो शक्ति है, इच्छा शक्ति और दृढ़ संकल्प, जिसके चलते हमारा देश दूसरी लहर से भी हम निकल पाए। कठिन घड़ियों में उनके इस उल्लेखनीय योगदान का जितना भी व्याख्यान किया जाए उतना ही कम होगा। आज देश का हम जान रहे हैं रिकवरी रेट लगभग 97% का हो गया है। तेजी से मामले कम हो रहे हैं, लेकिन फिर भी हम सभी को सतर्क भी रहना है और सावधान भी रहना है। और आप सभी के सहयोग से टीकाकरण में देश लगातार बेहतर प्रदर्शन कर रहा है। आज दुनिया के कई देशों को पीछे छोड़कर हम टीकाकरण में काफी आगे बढ़ चुके हैं। 33 करोड़ से भी अधिक टीका कल तक लग चुका है। इसमें निरंतर बढ़ोतरी भी हो रही है। आदरणीय प्रधानमंत्री जी ने 21 जून से जो टीकाकरण महाअभियान, विशेषकर 18 वर्ष से ऊपर के लोगों को मुफ्त टीकाकरण का जो अभियान चलाया, उससे देश में नौजवानों में भी काफी उत्साह दिखाई पड़ा, और इसके बेहतर परिणाम भी जगह जगह से आ रहे हैं। चाहे गांव हो या शहर, सभी जगहों पर दिखाई पड़ रहे हैं। लोगों को टीकाकरण के लिए हमें निरंतर जागरूक भी करते रहना होगा। भगवान ने हमें यह शरीर दिया है, यह शरीर नश्वर है, हम जानते हैं। आत्मा अमर है, किंतु जब तक शरीर है उससे मूल्यवान कुछ भी नहीं हो सकता। और इसलिए कहते हैं, क्षिति जल पावक गगन शरीरा, पंच तत्व निर्मित यह अधम शरीरा। यह शरीर पंच तत्वों से बना हुआ है और फिर पंच तत्व में ही विलीन हो जाता है। लेकिन हम इस शरीर को मूल्यवान समझते हुए इस शरीर को उपभोग नहीं, बल्कि यह शरीर उपयोग के लिए कैसे हो, मानव हित में कैसे यह शरीर हमारा उपयोगी हो, इसका हम सब ख्याल रखते हैं। में आप सभी ने जो अभूतपूर्व कार्य किए, वो अत्यंत ही मानवीय है। हम कहते हैं मानव सेवा, मानव सेवा, जन सेवा, जनार्दन सेवा, नर सेवा, नारायण सेवा। ये ऐसी उत्कृष्ट सेवा है जिसका उदाहरण आप चिकित्सक और चिकित्सा कर्मियों ने समय समय पर इसको दिखाने का काम किया है। आज भी दृढ़ प्रतिज्ञ होकर के अपने कर्तव्य में जुटे हुए हैं। ये हमारे लिए गौरव की बात है। अब मैं अपने देश के नागरिकों को याद दिलाना चाहूंगा कि हम इस दिन को चिकित्सक दिवस के रूप में, कल चिकित्सक दिवस है, उसके पूर्व आज यह कार्यक्रम आयोजित है। और चिकित्सक दिवस यह दिन, जो चिकित्सक दिवस 1 जुलाई होगा, वह पश्चिम बंगाल के दूसरे मुख्यमंत्री और सुप्रसिद्ध चिकित्सक के रूप में डॉक्टर विधान चंद्र राय के जन्म और देहावसान के दिन को स्मरण कराता है। और इस दिन हम देश में स्वास्थ्य के क्षेत्र में उनके बहुमूल्य योगदान के प्रति अपनी श्रद्धांजलि भी अर्पित करते हैं। भारत ऐसा देश है जहां चिकित्सकों की पूजा की जाती है और चिकित्सकों को दूसरा भगवान के रूप में भी लोग मानते हैं, पुकारते हैं, और इन पर हमारी हर उम्मीद भी टिकी होती है। इनके अथक प्रयासों के चलते हमारी स्वास्थ्य परिचर्या उसको पूरी दुनिया में बार बार प्रशंसा भी मिली है, हमें गौरव प्रदान हुआ है, और हम रोगियों को दी जाने वाली सेवा के लिए भी जाने जाते हैं। भारत सरकार ने देश की स्वास्थ्य परिचर्या प्रणाली को सुदृढ़ करने तथा चिकित्सकों को उनका श्रेय देने के लिए भी पहल की है। सरकार द्वारा प्रधानमंत्री आत्मनिर्भर स्वास्थ्य योजना तैयार की गई है, जिसका उद्देश्य स्वास्थ्य परिचर्या प्रणाली उसका संवर्धन करना और साथ ही महामारी के कारण वर्तमान और जो भविष्य है उसमें हमारे सामने आने वाली जो कठिनाइयां हैं उसको दूर करना है। प्रसार का पता लगाने और इसे नियंत्रित करने के लिए सुदृढ़ सूचना प्रौद्योगिकी समर्थित सर्वेलेंस प्रणालियां, जो सर्वेलेंस सिस्टम है, उसको तैयार करने में भी सहायता मिली। इसके अलावा इस योजना के और भी अनेक घटक हैं, जिनमें आपातकालीन जो अनुक्रिया है उसके समय पड़ने वाली जरूरतों को पूरा किया जा सकता है, जैसे कि उन्नत उपचार के लिए क्रिटिकल केयर ब्लॉक प्रशिक्षण और परामर्श, जन स्वास्थ्य प्रयोगशालाओं के नेटवर्क में सुधार और नए क्षेत्रीय रोग नियंत्रण केंद्र की स्थापना आदि अनेक प्रकार के कार्य हैं। महामारी का यह दौर बहुत को, उनके परिवार के सदस्यों को जहां खोने की पीड़ा से तड़पते हुए देखा है, जहां श्मशान घाट में लाशों के बीच लोगों को चिल्लाते हुए देखा है, यह बहुत ही दुखद नजारा। हमारे कई चिकित्सकों और चिकित्सा कर्मियों ने अपनी प्राण की बाजी लगाकर अपनी आहुति दे दी। बड़े बड़े श्रेष्ठ चिकित्सक देश भर के जो आज हमारे बीच नहीं है, जो मानवता की सेवा कर रहे थे, इंसानियत की सेवा कर रहे थे, आज हमने उनकी सेवा को खोया। हमें वह भी कष्ट है, और इस दुखद नजारा को हम सब लोगों ने देखा है। सोचे कि इन डॉक्टरों के सामने कितने रोगियों ने दम तोड़ा होगा, अपने कर्तव्यों का निर्वहन भी करते रहे। साथ ही ये योद्धा लगभग 15 महीनों से इस वायरस से लड़ रहे हैं। यह दुर्भाग्यपूर्ण है कि इस महामारी के दौरान हमने अन्यों के साथ साथ बहुत से ऐसे अच्छे डॉक्टरों को भी खोया है। इस महामारी में हमने कई डॉक्टरों, नर्सों, आशा कर्मियों को भी खोया, जो जमीन पर नीचे काम करने वाली हमारी आशा बहन है। ऐसे लोगों को भी हमने सेवा करते हुए, और उन सब लोगों को हम याद करते हैं, सेवा करते हुए अपने आप को ऐश्वर्य भगवान के श्री चरणों में अर्पित कर लिए। भारतीय अनुसंधान संघ की रिपोर्ट के अनुसार दूसरी जहां तक अभी सूचना प्राप्त हुई है कि 766 डॉक्टरों की मृत्यु हुई है देश भर। इन फ्रंटलाइन कार्मिकों के परिवारों की सहायता और उसके लिए सरकार ने प्रधानमंत्री गरीब कल्याण पैकेज के साथ साथ बीमा योजना भी शुरू की है। इसे विस्तार देकर 22 मार्च 2022 तक हमने इसको आगे बढ़ाया। यह योजना कोविड-19 से लड़ते हुए मरने वाले स्वास्थ्य परिचर्या कर्मियों को क्षतिपूर्ति करने हेतु हमने शुरू की गई थी, और हमने इसको आगे भी बढ़ाया। हालांकि ये पैसे का कोई भी महत्व नहीं है जीवन के साथ। बहुत ही हम कह सकते हैं कि ये जो कुछ भी प्रयास हमारे लिए महत्वपूर्ण है। आज हमें आशा कर्मियों के अथक प्रयासों को मान्यता और सम्मान भी देना चाहिए। जो लोग गांव-गांव से कोविड के कालखंड में पहले और दूसरे फेज में घरों से जांच करके उनको पूछते रहती थी, उनको अस्पताल तक भर्ती कराने में सहयोग करती रही है, सचमुच में उन्हें भी सम्मान हम देते हैं। उन्होंने अपने सामान्य कर्तव्यों के अलावे कोविड के दायित्वों को भी बखूबी निभाया है। मैं आशा कर्मियों, चिकित्सकों, नर्सों और अन्य चिकित्सा कर्मियों के संयुक्त प्रयासों के प्रति पूरी तरह से अपनी कृतज्ञता भी जाहिर करता हूं, और साथ ही इन कर्मियों के लिए मेरा यही संदेश है कि सकारात्मक दृष्टिकोण बनाए रखें तथा लगन से अपने कर्तव्य को भी निभाते देख रहे हैं। इस मुश्किल समय में आप देश के एक सुदृढ़ स्तंभ बनकर खड़े हैं तथा हमारी आशाएं आप पर भी टिकी हुई है। हम आपके समर्पण, धैर्य और साहस के लिए आपके प्रति कृतज्ञता और सम्मान भी ज्ञापित करते हैं। रोगियों के प्रति आपके समर्पण के कारण ही कई जिंदगियां आज बच पाई। प्रारंभ में इस वैश्विक महामारी ने हमारे देश तथा देश के स्वास्थ्य परिचर्या प्रणाली पर काफी दबाव डाला। उस आबादी के बारे में अनुमान लगाना ही बहुत मुश्किल हो गया था जो इस महामारी से प्रभावित हो सकती थी, और इसलिए सरकार ने एक मिशन प्रारंभ किया जिसमें विशेष रूप से अधिक विस्तरों को शामिल करना। हमने देश भर में इंफ्रास्ट्रक्चर को भी बढ़ाया और लाखों बेड्स भी हम तैयार युक्त बेड तैयार किए। वेंटिलेटर, हमने हजारों वेंटिलेटर देश भर में अस्पताल को सुपुर्द किया, और जहां हमारे पास एक भी जांच नहीं होते थे, मात्र शुरुआत के दौर में मुझे याद है कि 100 जांच पुणे के लैब में होता था, वहां आज हम 20 लाख लगभग जांच RT-PCR टेस्ट प्रतिदिन कर रहे हैं। जहां हमारे पास टेस्टिंग लैब कम थे, एकमात्र लैब था, आज हम लगभग 2500 से 2600 से ज्यादा लैब देश भर में सरकारी और प्राइवेट स्तर पर हम स्थापित कर सके। उतना ही नहीं, हमारा आप सबसे विशेष रूप से हम ये जानते हैं कि देश के कोने कोने में आज जो टेस्ट लगातार होते रहे, लगभग 41 हुआ है आज तक, और हम सब लोग बड़े ही सौभाग्य से कह सकते हैं कि आदरणीय प्रधानमंत्री जी ने हर प्रकार का सामग्री हम सब लोगों के लिए सुलभ, जहां गरीबों के लिए 80 करोड़ लोगों को आज मुफ्त राशन पिछले 2020 में भी और 2021 में हमने प्रदान करने का प्रयास किया। यह सरकार का कर्तव्य है और हमने उस कर्तव्य को निभाया है और आगे भी निभाएंगे। और मुझे विश्वास है कि आप सब लोग इसके साक्षी के रूप में हैं। कोविड-19 के पहली लहर को हमने उस बड़ी संख्या में लोगों को अपना रोजगार और संसाधन भी जुटाने का काम किया। आज इस अवसर पर मैं आप सब लोगों को बहुत बहुत बधाई देना चाहूँगा और यह भी कहना चाहूँगा कि आपके माध्यम से जो यह सेवा हो रहा है वह सेवा अच्छी सेवा के रूप में हम लोग उसको प्रदान करते रहेंगे। आज के इस अवसर पर मैं आप समस्त चिकित्सक गण को, चिकित्सा कर्मियों को, विशेष करके इस डॉक्टर्स डे कॉन्क्लेव में जो आज वक्ताओं ने अपनी बात कही है, मैं बहुत बहुत उनसे प्रेरित हूँ और द इकोनॉमिक टाइम्स के द्वारा यह जो कार्यक्रम आयोजन है, मैं आभारी हूँ उनका कि आपने मुझे यहाँ जोड़ने का काम किया और आज वर्चुअल माध्यम से हम आप बातचीत कर रहे हैं। तो मैं आज डॉक्टरों तथा उनके द्वारा किए गए उल्लेखनीय योगदान को हम सम्मानित करते रहेंगे और इस घड़ी में उनके द्वारा जो सेवाएं प्रदान की गई है उनके लिए हम सदैव उनके ऋणी रहेंगे। मैं आज इन्हीं शब्दों के यही विश्वास सरकार की ओर से दिलाना चाहता हूं कि सरकार जनता के सुख दुख को देखते हुए आपके हर प्रयास को हम चुनते रहने का काम करते रहेंगे और साथ ही हम अपने संसाधन को भी बढ़ाते हुए लोगों को सुख शांति मिले इसका पूरा प्रयास करेंगे। लोग स्वस्थ रहें, सुखी जीवन व्यतीत करें और मैं इन्हीं शुभकामनाओं के साथ सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। सभी सुखी रहे, स्वस्थ रहे और सबके ललाट चमकते हुए दिखाई पड़े और एक दूसरे के पीड़ा को अपनी पीड़ा समझ करके उनकी पीड़ा को निवारण करने का हर संभव प्रयास करें। यही मानवता है, यही इंसानियत। मैं इन्हीं बातों को कह करके अपनी वाणी को विराम देना चाहूंगा और आप सबको पुनः बधाई भी और चिकित्सा दिवस की अग्रिम बधाई भी आप सबको मैं दे रहा हूँ। बहुत बहुत धन्यवाद। जय हिंद, जय भारत, वंदे मातरम, नमस्कार।
बहुत बहुत शुक्रिया आदरणीय मंत्री जी, आपने सराहना की जो हेल्थ केयर वर्कर्स हैं उनकी और ये भी विश्वास दिलाया कि आगे चल के जो गवर्नमेंट है वो पूरी लगन से उनकी देखभाल करेगी, चाहे वो डॉक्टर हैं, नर्सेज हैं, आशा वर्कर्स हैं, बाकी टेक्नीशियंस, हेल्थ केयर वर्कर्स हैं। इसके लिए आपका बहुत बहुत आभार और मैं आश्वासन दिलाना चाहूंगा पूरी हेल्थ केयर फ्रेटर्निटी की तरफ से कि हम भी कोई कसर नहीं छोड़ेंगे इस लड़ाई में और आगे भी जब भी मौका आएगा हम इस लड़ाई में अग्रसर रहेंगे। बहुत बहुत धन्यवाद, आपने समय निकाला। Thank you very much. Dr. Trehan, I know you've been waiting for a long time and I know you came out of the OT. Dr. Trehan, in the late 80s, you were a harbinger of change in this country. Patients used to have to go out of the country to get cardiac surgery, even routine cardiac care of the interventional kind done. And you were responsible for changing that. In this COVID fight also, the Medanta hospitals have been at the forefront. And from the first few Italian patients that were admitted there to thousands of patients that you've treated over the last 16 months, what have been the learnings? How have private hospitals changed during this time? How much of this change you think will be permanent? And will we keep shifting our focus so as to better serve patients in the future? Also, I know that Medanta was doing an outreach into rural areas. Would that continue? And how would that be escalated? Dr. Trehan, please.
So you're not audible.
You're on mute, sir.
That's good. Sorry about that. Now, thank you, Harsh, for those kind words. First of all, if you were to compress this whole thought process, we were actually moving along, cruising around quite well in our progression, in our delivery of care, with the new schemes that came in, with all the new facilities in the government and private sector that came around. And then we got a shock. So it has taught us the fact that your planning and your ability to move along those plans can always be disrupted. This was something that has given us a wake-up call. I think you said it earlier also that for many years that we know where our creaky points are, where our deficiencies are. So in a way, if you look at it holistically, COVID has really devastated many families, many areas, economies. It has been devastating. But at the same time, it has given us that ability to say, we need to reorient ourselves to the current environment. So what are the current environments? First of all, Tom Fried, who's a New York Times writer, he explained that this, in his view, is a war between Mother Nature and Father Greed. Because we have disrupted the ecosystem so successfully over the years, that we have given opportunities for the opportunistic, whether it's bacteria, virus, whatever diseases we can find, it has given them an opportunity to actually recreate that whole scenario in front of us where we have understood that we are vulnerable. Nobody ever imagined that this kind of thing would happen because it shook the whole world. All right, coming back to your question. So we know that we need to be prepared for shocks like this in the future. We know it's not going away, and we know there is no reason to let our guard down. So these are all known things. Now, moving forward, of course, we'll work differently. We have all learned. But one big thing we learned in this whole malady, and which changed the entire flow of patient care, was those doctors in Bergamo, Italy, who, against the advice, they were banned by a WHO from doing autopsies on patients, who had the courage to go ahead and do 50 autopsies, and they actually described the pathophysiology of this whole malady. If it wasn't for them, we were lost. We were just concentrating on lungs and oxygen, and that's all. We did not understand the full chain. So that saved millions and millions of lives around the world, that knowledge. So it shows you that if you do not have the guts to actually look at science in its entirety, and you are so comfortable just cruising along, doing what you are doing in a mundane manner, we will suffer because, like I said, this is a changing environment and we must be able to face it with all our courage. We've done very well and not so well. Okay. Like everybody around has said, there is a lot of preparation to be done, because if it is not COVID, It may be something else. We are vulnerable. That has been shown. And we will not, so that means from the environment to our way of living, to the way we take care of our own society. And that whole continuum will have to be looked at in a fresh way. And unless we do it together as a nation, as a world, we will then again get these shocks, and then we don't know how much, we are talking about India, what we see every day. What has happened to the rest of the world, which was even weaker than us? So their hope of recovery in the next 5 to 10 years has even become all further away for them, because what it's direct. So medicine will be practiced in actually more digitized manner, for sure. There will be early sensing warning systems like we have for the weather, like we have for aircrafts. The entire world's aviation industry is controlled from one center in Oslo. They know those billions of planes up in the air. They have early warning systems. They warn them about weather. They warn them about everything. But we don't have that early warning system in the medical or in our healthcare system. So India, if I come back to India, I think the building blocks have all been named. They have not been successful yet, but they have been named, starting from Swachh Bharat, Swasth Bharat. They are actually cousins who don't talk to each other. We need to bring all these things under one command. So Ayushman, Swachh Bharat, Swasth Bharat should be all in one stack. And I'm sure Dr. Guleria, I don't see his face, but he may be listening, so he can carry this message everywhere. That if we can do that, we will build the backbone at the bottom of the pyramid going up, making it possible for the pyramid to be strong and lasting. Because we cannot do anything with a creaky bottom. So if we build that, then there are many ideas beyond. And one of the challenges we are facing today, and we will continue to face, is the challenge of or the divergent view on delivery of cost of delivery of healthcare to what the real cost is and what should be the real margins. Unless we actually, all of us, work together to establish that is a fact, to say, how are we going to move forward so that there are no accusations, there are no barriers between public and private health, and that everybody's expectation of how much margin you're going to make and in what margins you have to live should be specified now. Now it happened in the vaccine thing. Vaccine was opened, okay, private sector, you buy it yourself, you order it. What happened? It created a huge inequity because of the fact that whoever could buy, bought it, whoever could deliver it at a higher price, delivered it. There was this profit motive came in right away, and then we got a bashing. So as doctors, as responsible citizens, we must lead the way into something which says everything has to be put in proportion. We have X margin, which we will work within, but the real cost is this. Unless the real cost is established, we will never get peace in our whole system. Because today, every time somebody gets into trouble, they will accuse us. Do you realize what went in? So all this doctor bashing, all this violence, all this has to stop, because there has to be actually leadership and quality in our dictating how we practice medicine and under what circumstances, how much investment, what are you allowed to make on it. If that is established, we'll all be a happy lot. So I think there is a lot of work to do. Back to the drawing board. We can all do it together. But the problem is the doctors actually are so busy or so involved in their own little streams that we don't get together to really work out the full stack. We should have that white paper which describes from bottom down to the top, and then engage with the powers to be. If we do it together, everybody, every day we hear, this delegation went to meet so and so. This delegation, why? Why not just one delegation which goes everywhere? We have Devi on the screen. You are there. Dr. Guleria is there. Our Honorable the Director General is there. Ambrish is there. All senior people. And let it not be only private or only government. Let there be an amalgam. And if we work together, we'll get a lot of peace. We'll make great progress, and we'll still get a great living. So doctors will still have a great living. But it is not systematized right now, which I think would be helpful. Thank you.
Thank you very much. Thank you very much, Dr. Trehan, for those multiple thoughts. Thought about greed, and it may not only be greed for money, it may be even intellectual greed. We hear of gain of function research, which may or may not have been responsible for this virus. And you talk of viability of the healthcare system, where the costs can be determined, be known, be transparent, so that no one can accuse a private healthcare system of, wanton profiteering. So there are many things to be done. Thank you for your comments. And now, Dr. Ambrish Mithal, one of the foremost doctors of the country, endocrinologist, diabetologist. Yes, Dr. Trehan, you wanted to add something? You're muted. You're muted.
Okay, first I want to apologize to Ambrish that I'll have to go back to the OT, but I will get your comments back. And sorry to everybody, but please allow me. Otherwise, there'll be some problem. Okay, thank you so much. I appreciate this opportunity. Times of India and all of you together, including Harsh. Thank you so much. Bye.
Bye, sir. So, Dr. Mithal, you are a person on the ground. I know your OPDs used to run from 8 a.m. to 8 p.m. and there would be crowds outside. And most of us have rung you up at some time or the other and said, एक ये मरीज जल्दी देख लीजिए, इसको 1.5 महीने की डेट मिल रही है. How have you coped during these times? How has your practice changed? Because you look at patients who are chronic patients. Of course, you do see patients who may have acute illness, but by and large, these are follow-up patients, acute patients. What have been the way you have changed your practice, and what are the learnings for the future?
Thank you, Harsh. Thank you for including me here. It's an honor. I'd first like to pay tribute to our colleagues who have lost their lives or families in this huge wave of viral infection. I'd also like to thank Economic Times for involving me, and of course think of Dr. B.C. Roy, who straddled the world of medicine and administration politics with equal ease and made such huge contribution to the country and to the world, on whose name this Doctor's Day is celebrated. So we all know, Harsh, we thought of a virus as a virus that will infect the world, and Dr. Guleria will take care of it and others will take care of it. It's a respiratory virus. But the fact is that the interaction between non-communicable disease and this virus is really strong. And what came to light in the very first few weeks of the pandemic was that people who have chronic disorders like diabetes, and India is one of the highest prevalence rates of diabetes in the world and the highest number of people with diabetes in the world, close to the highest. So clearly those who have diabetes and attendant blood pressure, kidney disease, heart disease are the ones who are succumbing to this virus, which means, and we also know the whole interaction between COVID and diabetes, and there's a talk in the same summit that I'll be giving in the afternoon. I'm not going into that. But the fact is that it proved a point that if the population is intrinsically unhealthy with regard to non-communicable disease like diabetes, etc., diabetes being like an index of that, you are likely to suffer much more. So if the virus spread in two populations, one population had a prevalence of diabetes of 5%, other had a prevalence of diabetes of 40%. Okay, the virus will wreak much more devastation, havoc in the population with high prevalence of NCD. So for me, the first general lesson before I come to my practice, the first general lesson is that we have to focus on non-communicable diseases. It's, as the Lancet said, it's like a syndemic. Syndemic meaning a combination of two epidemics. That is, one is the viral, the infectious, and the other is the non-communicable disease underlying NCD. I think that's really important. We have to reboot the NCD program. The wellness clinics, I'm part of the National Health Authority also. The wellness clinics that are not taken off as much as the other parts of Ayushman Bharat, all those require focus. Prevention is very, very important. We need to strengthen our primary healthcare, as Randeep mentioned initially, and there is no doubt about that. At the private sector setting, it is important that what the pandemic has taught private hospitals. It is very difficult to have a viable model which seemed to be working well using only elective high-end surgeries. You cannot survive, and some hospitals left that area unprepared because they were focusing only on high-end surgeries, which are highly skilled and the pride of the world actually. But the fact is that you need to have a solid medicine base. You cannot run a medical service, surgical service, high-end service without having a solid medical meaning physician base, internal medicine base, infectious disease base. Without that you cannot, or a chronic care. What we did,
Dr. Mithal, I'm getting repeat messages saying that we are running late. How did your practice change? How did your patients benefit from your expertise during these 16 months?
We learned a lot. We were talking about many things which we implemented now. And among the things that we implemented was the extensive use of video consultations or online consultations, which we were doing like 1 or 2% of our total practice. But now there was a phase when it was 100% of our practice. And the fact that these tools are available have allowed us, my personal team, my team itself, to deliver more than 8,000 formal video consults over the last 1 year or so. And I think that has also allowed us to test the model. So we tested 50 patients in each arm, those who were seen physically versus those who were seen for the first time on telemedicine. And we actually found that the results of diabetes control, cholesterol control, blood pressure control were equally efficient or equally striking during using telemedicine. So I think it's important.
That's great to know. That's really great to know, and maybe that's the future. Patients don't need to come from far and wide, wait in a clinic, and then when it can be done online. So I would give the final word to Dr. Randeep Guleria as to the hope that we have in the coming months, and how actually with him at the helm of affairs, both at AIIMS as well as in policy making, what are they envisaging in the months and years to come? Quick 2 minutes, sir.
Thank you, Harsh. What I'd like to just say is 2 or 3 things. One is the virus is here to stay, and therefore we will have to develop a new normal for quite some time in terms of infection control measures, and we will have to see how we can strengthen our health infrastructure. And when I talk of health infrastructure, it's not only for communicable diseases, it's also for non-communicable diseases, because they also form a huge burden of disease in our own country. And as was very rightly pointed out by Dr. Ambrish Mithal, there is a lot of connect between the two. And a lot of infectious diseases are driven by poor control of non-communicable diseases, diabetes and coronary artery disease for that matter. And therefore, I think it's very important for us to look at health in a holistic manner. I also feel that we should start looking at the concept of One Health. We're looking at health of not only humans, but also of animals and plants, because whatever outbreaks we've seen in the last 15 years, H1N1, Ebola, Zika, MERS, SARS, and now Corona, all have been viruses which have jumped species. And therefore, there is a concept that we should look at health of animals, for plants, of the environment, and then we will have a holistic approach as far as health for this planet is concerned. Thank you.
Thank you very much, Randeep. And with that, we come to the end of this session, which had to be split into 2 parts. Thank you all very much, Dr. Guleria, Dr. Mithal, Dr. Sunil, Dr. Devi Shetty, and Dr. Trehan. And now back to the organizers. Thank you.
Thank you so very much, Dr. Harsh Mahajan. It's been a pleasure having you as a moderator, sir. You made this discussion so very versatile, especially getting all those pointers from our Power Pack panelists. Like we've been saying, we've got the very best from the industry across the country. It's been a pleasure having Dr. Guleria here with us. It's been a pleasure listening to Dr. Sunil Kumar, Dr. Naresh Trehan, who was kind enough to step out of the OT, join us, and then head back. Thank you so very much, Dr. Devi, Prasad, Shetty, Dr. Ambrish, Mithal. It's really been a learning experience for us all. And Dr. Mahajan for really going to and fro between discussion. Of course, we look forward to the minister's session there. He had some fantastic messages, and many, many congratulations to each one of you for doing some fantastic work that you are day in and day out. This really is a way of us saluting all of you, all the work that you and your teams are doing. So thank you once again for joining us.
Thank you. Thank you.
And as we thank our doctor leaders right there, I'd also like to request all our delegates to please stay tuned in. We have some very, very interesting things lined up for you all through the day. Very soon, we will be unveiling our Economic Times Doctors Coffee Table book as well, right here on this interactive platform. I'd also like to request all of you to please stay tuned for our felicitations of the inspiring doctors, which will begin shortly. For now, we have a very, very interesting session lined up for all of you, navigating the COVID-19 pandemic. And very soon, I'll be inviting right here Professor Rajendra Pratap Gupta, global healthcare leader and public policy expert, along with Mr. Gautam Gambhir, member of the Lok Sabha, former cricketer. We all know him so very well. Both of them in a fantastic conversation right here. So I'd like to request all our viewers to please send in questions, because I'm sure they'll be more than happy to take the same. So let's look forward to this session.